therapeutic management in a patient with hyperthyroidism. So, if a patient has hyperthyroidism, there are several ways we can manage them. Number one, we can give them medical treatment, medication. Number two, we can remove that's like a part of the thyroid gland or the total thyroid gland. When we remove a part of the thyroid gland, we call that partial thyroidectomy. If we remove the whole thyroid gland, we call that total thyroidectomy. Okay? And then we can also do what we call ablation. Ablation is like burning the thyroid gland off. Ablation is like burning it off, literally. Okay? So we can do medical management with medications. And some of the medications we can give can be methimazole. And then another medication, we call it propylthiouracil. The medications are methimazole. And then another one is called propylthiouracil. Okay. Propylthiouracil. So methimazole, propylthiouracil. These are two medications we can use. And you can take your time and go through them. One thing you need to know about these medications is that they can cause agranulocytosis. Agranulocytosis basically means decreased white cell count. Agranulocytosis, decreased white cell count, or even no white cell count at all. So we've learned that we can give methimazole or propylthiouracil. The next treatment option can be surgery, and the next treatment option is ablation, where you can burn it off totally. Okay, so now, what is the nursing management of patients with hyperthyroidism who do not need surgical care? Those who don't need surgery, what is your obligation? What is your management of that kind of client? Number one, we said that their basal metabolic rate is high, and they may have, a lot of uneasiness, they may have a lot of heat intolerance. So one thing you want to do is that their room, you want to make sure that their room is cool environment. Number two, you also want to encourage good rest in these clients because, they can be so tired, they can be restless. So you want to make sure that they have good rest, okay? And then remember that I said that some of them, their eyes can be bulging. So if their eyes can be bulging, you want to protect the eye with some tinted glasses, some eye shield, some cool moist compresses for irritation and artificial tears. So if they have that bulging eye, you want to give them tinted glasses, eye shield, or moist compresses for irritation and artificial tears. So please remember that, okay? Now, you can also monitor the visual acuity of the client. That is to check how well they can see. And you can also check for photophobia because we said that at times they cannot look at bright light. And you also want to check for visual acuity, how well they can read and all that. And then because their eyes are bulging, you want to make sure that there are no scratches on the cornea. All right? And you want to monitor the ability of the client to close their eyes. And another thing is that you also want to measure their weight as well. Okay? And because they can lose so much weight within a very short time, you want to address their body image concerns because the patient may be doing everything to gain some little weight, but they are not able to do it. So you want to protect them that way, and you want to educate them that way. Okay? Now, if you have a patient who is going for surgery for the thyroid, what is the preoperative nursing management of that patient who needs surgery? What's the preoperative nursing management? What should you do before the patient goes into surgery? Number one, you have to discuss the post-operative management plan with the patient, with the client. And then you have to also educate them that when they finish the surgery and they want to cough or they want to sit down or they want to, because they will cut this side of the neck, right? Or they want to turn, they should put their hands behind their neck. They should put their hand behind their neck. And you also have to do some patient education about how to administer some, some thyroid medications. You want to do the patient education so that you can let them know, hey, you've got to take your medication every day. you've got to take your medication every day. You want to do that. And then after the surgery, this is post-op. After the surgery, what are you going to do for them? You want to give them analgesics. And then number 2, so analgesics like what the surgeon will prescribe. And then you want to put them in a semi-fowler position. Semi-fowler position, okay? Semi-fowler position. I'm going to show you a picture of semi-fowler position. And you can give them ice collar to the wound for comfort and to prevent edema, okay? And then to assess the surgical site for bleeding. So you want to watch and monitor the surgical site and make sure the patient is not bleeding. And then you also want to listen over the trachea for what we call stridor, okay? And then you want to monitor for respiratory distress as well in the patient. And you want to keep an emergency tracheostomy tray, because at times the patient may be in some form of respiratory distress and you have to just put in a tracheostomy tube or call the doctor to put in a tracheostomy tube. And the room the patient is in after the surgery should be humidified. And you want to encourage the patient to do deep breathing exercise. And you want to maintain a patent IV line. Patent IV line. So if I wake you up and I say that, hey, we've done a surgery on this patient, what should we do? You should be able to outline all these things for me, very simply. And this is the semi-fowler position I was talking about. So when the patient has had the surgery, you want them to be in semi-fowler position. This is the position. Semi-fowler position. This is the position, okay?